All right, thank you for joining us today. Most medical practices spend huge amounts of money trying to attract new patients, but often overlook the easiest win, keeping the ones they already have. In today's crowded healthcare landscape, loyalty isn't about satisfaction, it's about building trust, connection, and long-term engagement. My guest today, Rishik Dhar, founder of SolidAI, is helping practices rethink how they approach retention by blending behavioral science, data, and AI-driven engagement. Solid is creating a fresh model for patient loyalty that is cost-effective, scalable, and impactful. And we're going to explore what loyalty really means in healthcare, why it's more urgent than ever, and how providers can implement strategies that truly move the needle. We may dive into a few other topics as well. But Rishik, we are so glad that you joined us and have taken time out of your busy day to share what you're doing at Solid AI. I wanted to just start, if you could introduce us to yourself, where you've been, what you're doing, and tell us a little bit about Solid AI and the niche it's making in the healthcare market.
Thank you for inviting me, Mark. It's my pleasure to be here. I just wanted to make one tiny correction. It's SolidHealth.AI.
Solid Health. Sorry, my notes
Yeah.
were, I left out the health in my notes.
Yeah, but that the intent is to be a solid company
Yeah,
that
absolutely.
advocates for consumers in the healthcare space. A little bit about me. I have been in the software world building products for over 25 years. My last job was at Amazon, where I was managing the behavioral features. While working on that job, I realized that there is so much impact one can generate by looking at these behavioral features and guiding people in their journeys. And that was the key insight that allowed me to kind of venture out and start thinking about other application areas. And healthcare turned out to be the one that was hurting the most. And it became a natural choice, particularly because I started looking into the problems people face. And that reminded me of the problems that I have faced caring for my mother, who doesn't live with me, but when she was visiting, she had a medical incident. And I found myself to be pretty helpless because I didn't have
Mm.
her health data with me, and that recollection of that thought, and then later on a conversation with my currently like the partner in this journey, Rahul Razdan, who's the chief product officer, and learning that he faced the same problems for his mom. Made us realize that healthcare was the space that we wanted to be in, even though we don't have any prior experience, and bring our product and data science and AI skill set to build a capability in this space.
Oh, that's amazing. And what a great intersection of technology. And yeah, I can imagine the application just for what you mentioned. Yeah, yeah. Well, I want us to talk a little bit about your platform, but also just this idea of how it can help healthcare providers provide more consistent touches for their patients in this area of retaining patients rather than simply trying to look for new ones. When you think of retention, a lot of people think of just follow up. How would you define patient retention as it relates to what you're doing with Solid Health?
Absolutely. It's a great question. I think we are rethinking retention a little bit, or what we also know as patient loyalty. We think a patient or a consumer has the utmost loyalty to their own self-interest, and that's how it should be. For somebody who is struggling with healthcare issues, their goal, their single-minded focus and attention should be on how to get better, and everything else should probably fade out into the background. And that's the idea that we are propagating through our product design. We want a loyalty or retention to be a side effect of delivering trust and care to the patients, something that can be measured, something that can be demonstrated with concrete data and personal experiences that patients share about their journey through an healthcare issue they might be encountering, or even just general wellness. So I think that's what we are focused on. We are super strong on consumer advocacy just for that reason, because the loyalty or the retention is to the cause of improving your health rather than anything else that exists in the healthcare ecosystem.
Okay. All right. All right. So, can you share just for a couple of minutes? Let's say someone is involved with your platform and they're going to be using this tool. Can you give us just a really practical application for how that would work with a patient that was on the Solid Health system?
Absolutely. So we have we call this a value loop. Basically, it's a flywheel of how a patient engaging with our platform or our product would experience personal benefits or gratification. There are three stages to that flywheel. The first stage is assessing personal health by consolidating data across different EHR tools and wearable devices. We classify data under two categories primarily: the institutionally controlled data and personally controlled data. So wearables and files that you have access to or are within your control is what we call personally controlled data or individually controlled data, and EHRs and lab results are what we call the institutionally controlled data. I forgot, wearable devices are also a part of your individually controlled data. So what we are doing in the assess stage of this value loop is we are allowing patients or users to bring all of their data into a single repository where it can be correlated, and we can build a comprehensive view of their health and organize it in functional health areas. So instead of telling someone their cholesterol is high or their lipid profile is not doing well, if we can tell them that they might have a risk of worsening their heart health over a period of next 10 years if they didn't do A, B, and C as expressed in their clinical data. We are not talking about diagnosing, we are talking about interpreting the diagnosis that has already been provided by a provider and what the possible consequences can be. So this is the assessment stage. This is where you understand your health, almost like understanding your net worth in a financial paradigm. The second stage is engage, which means we help you build personalized plans of either treatment or wellness or just staying fit in general. And what we consider important over there is the social determinants of health play a big role in building an engagement plan or an engaging personalized care or treatment plan, because what we recommend to one individual sitting in one corner of the country may not work for another individual with the same conditions, but sitting
Sure.
in a different corner of the country. So we build some of these behavioral signals into the engagement paradigm that we are introducing. And then the third stage is improve. So once you have been able to assess your situation and you're engaged, now you can look at the metrics and improve results over time by monitoring it yourself. So this is what we expect users to experience. And we can keep talking about more sort of specific ways in which we can present these three stages or manifest these three stages within our application. So I hope that kind of gives you an idea of what we are offering.
Sure. So you want to be involved really in the onboarding process of a patient, I'm imagining, getting this data and then providing them additional support along the way, which is a different way of thinking through traditional measures of maintaining patient relationships versus a call us in 30 days, 60 days, 6 months, a year, to more of a regular, updated, being able to follow your plan and then get some advice on how to improve on that plan. Is that correct?
That's absolutely right, because nobody is more vested in your health than yourself.
What benefits do you see to the consumer that hasn't experienced a tool like yours? What are they going to see differently than on their normal visits with their physicians? And how is this going to interact on their daily life?
Simple. It is not rocket science. In simple words, being able to visualize and interpret your health as you should, depending on the stage of life you're in, depending on the conditions you experience, depending on whether your first language is English or some other language. If you're living in the United States and you're either speaking English or Spanish, and you're fine. But if you're not speaking either of these languages, how do you stay up to date with what the doctor said or what the nurse practitioner said, or, how you should be implementing your healthcare plan? So things as simple as that, understanding, interpreting in a culturally sensitive setting. Maybe it's just a muscle health issue. And a lot of times we will probably ignore it until it kind of worsens to a point where we are not mobile anymore. So how do we tell people that you don't have to necessarily wait that long? How do we inform them while keeping the conversation in their culturally sensitive setup? And how do we engage their caregivers? For instance, we are building this capability where the caregivers, which could be family members or friends or neighbors, they can be granted restricted access to your health data through this platform, but of course on your consent, on patient's consent, that access can be granted, and they can be simultaneously notified about certain risks that the patient might be facing. So I think what we are doing is we are trying to put a little more cultural sensitivity, the social determinants of health being like the central framework, and then also bringing community together in providing that support that is currently missing from most of the platforms.
Sure, sure. Can you give us a little bit? One of the interesting things in looking over Solid Health is just the integration that you have with a physician oversight while using AI assisted tools to do some of the hard lifting on managing the data. Can you give us just an insight about how that works with Solid Health?
Absolutely. So one of the solution areas that we are bringing this product to right now as we speak is skilled nursing facilities, where there is an interdisciplinary team of providers that must understand the patients they're dealing with and consult with each other as necessary and share data with each other and share insights with each other as necessary to provide the best kind of care. So that is a pretty big use case that we are quickly kind of receiving a lot of traction on, where being on our platform not only gives full control to the patient and their caregiver about their health, it also brings a set of interdisciplinary providers on the same page about the health, including what kind of concerns is the patient expressing. Say a nurse practitioner or a skilled nurse who's treating some individual, and we are mostly looking at senior care facilities right now because we feel there is a little more urgency to provide this kind of support, the AI enabled support to the seniors who deserve it the most right now. And there is larger set of issues they're dealing on an average about their health, which complicates keeping track of their health overall, like polychronic patients. It's often hard for them to understand how one condition might be interacting with the other condition and how one medication, taking it or not taking it, can have effects on multiple chronic conditions that they might be experiencing. So even these concerns, as they surface, we are making it incredibly easy through the use of AI to capture them and apply the right context and make them available to the providers. And these could be providers with different focus areas, keeping them on the same page. That's what we are striving for right now. That's the next phase of implementation that we are working on.
That's fantastic. I just in the last few years, my wife and I spent quite a bit of time caring for our parents and getting over that hurdle of understanding where they are when they're no longer able to really maintain their own record and ask the right questions, and they can't really tell you what you need. I can see the incredible value of that, but also the number of physicians, especially as you get older, that you're seeing, and just the amount of information that does or does not seem to go from practice to practice or physician to physician for an individual's care. I can see incredible value for that. So if I interpret what you're doing with Solid Health and what this tool has the capacity to do, one of the ways that you can help with patient retention is really just providing better quality care and attention so that they feel like they're constantly being taken care of. Would you say that's true?
Absolutely. Autonomy is what everybody cares for. Even as you grow older, even as your faculties kind of diminish with time, unfortunately, even then, you do not want to be dependent on anyone. One of our model cases, one of the, I would say, personas that we researched the most was a senior, or I would say an individual between the age of, say, 55 through 75. These are people who somehow we kind of imagine that, they are, somehow their desire to kind of manage their own life and their health has kind of evaporated, which is not true. Even if you are partially disabled, fully disabled, or even limited in some capacity, you still want to be fully aware of what's happening with your health and what kind of decisions matter to you. So I would say absolutely building that autonomy into healthcare for the patients is the most vital, underserved area that we are focused on right now.
Yeah, yeah. And it's interesting with your background in programming and software development rather than being a physician yourself, just an interesting perspective you bring to just providing, just the tools that your patients are going to need without having that same physician's perspective. When you think about these next 3 to 5 years, and I'm just we're seeing AI develop so quickly and so deeply. When you think over the next 3 to 5 years where technology is going, and especially in the area of patient loyalty, what are some changes that you think practices are going to have to be on top of to meet these needs and to maintain the interest of their patients to stay with their practice rather than looking for a competitor down the street? What's coming down the pike that people don't necessarily see?
That's a great question. And no matter how well informed I think I am, I'm probably going to get it wrong because it's hard to predict because there are so many
Sure.
things that need to be addressed. But here is something I wish that we will see a little more of, which is I have been to a couple of conferences this year, and every single conference has raised this concern about the shortage of providers, whether we are talking about doctors like family practitioners or we are talking about nurse practitioners. There's a huge shortage. We don't have the skills, a skilled staff to meet the needs. The senior population, which is our first target segment, is growing every year at about 17% year over year growth as reported by CMS. So in light of that situation where it seems like things are going to get harder and harder, like more and more resource constrained, what I'm hoping that AI can do is it can free up the time for a physician or a provider to perform clinical work rather than spend too much time on non-clinical work so that they can spend more quality time with their patients instead of rushing through like 50 patients or 10 patients. I've had the privilege to talk to doctors from across the country, and there are locations where doctors are required to see about 20 patients a day. So how much time do we think they are going to have to kind of listen to the patients and understand their needs and then
Hmm.
deliver quality care? And I'm really hoping that, including us, we play a part in making the delivery of quality healthcare easier, more possible, even as we face this huge resource constraint. And I think AI is quite potent and it can solve those problems if we are working backwards from the real problems rather than just taking a technology centric view. And that's what we are trying to do. Like, we don't have background in healthcare, but we have the privilege of connecting with some experts who have dedicated 30 plus years in their profession as physicians or nurses or healthcare administrators, and they are guiding our journey and telling us the problems that we are facing. I would like to close this with one little anecdote from last week. I was visiting a facility in Wisconsin who are seriously exploring onboarding our product. We are in a like a pre-pilot stage where they're evaluating the features of the product and how we may have to make some fine tuning to support their patients or their residents, as they call them. And the biggest thing they told me was the data exchange is so horrible today. You are still receiving these 40-page faxes from one provider to another, one facility to
Hmm.
another, and they have no idea how to share that data efficiently and inform the right stakeholders about what's going on. So not only are providers kind of missing the right information at the right time, even the family members are clueless because there is no system today as of today, October 1st, 2025, that I am aware of, which actually addresses this pain of family members getting to have a good understanding of, what their, care recipient really needs, what they might be going through. And I think AI is going to kind of change that. It's going to make it easier both for the providers as well as for the patient and their caregivers, much more easier and frictionless relationship, and which will enable the quality of care to improve over time. So that's what my sincere hope is.
Sure. That's fantastic. That's fantastic. Well, let me ask you to put on just your advisory hat for a minute. And let's say you
Mhm.
had a small to medium size health practice and they're looking to improve quality of care, maybe fill some of these care gaps. And let's say they have a limited budget. What's something they could try to begin to fill some of these care gaps as you've seen them? Don't have a lot of money to spend to create a whole program themselves. What would you advise a practice to do in that scenario?
Oh, that's a very hard question, and I by no means am an expert yet on like what's the vast set of possibilities that they might be
Sure.
facing. I think from my limited experience, a couple of things that are very clear to me is I think focusing on um, running some pilots. I know it's very like taxing, if not expensive. There are a lot of great AI-based startups who have small footprints, so they don't need a lot of money to kind of run these pilots, and maybe sometimes they would even do it for free. I would definitely encourage most of the facilities to explore the data strategy in collaboration with some of these AI-based startups and understand what they can do in reducing the data exchange overhead, because I think that's probably one of the biggest non-clinical activities that consumes the time, both in terms of entering the data into a system and then sharing that data within the right regulatory framework, maintaining data privacy and such,
Mhm.
sharing that data with across different stakeholders. That is probably the most expensive non-clinical activities most facilities, at least in my knowledge, are spending time and money on. I would say team up with a small startup if you come across them and share these problems and let them, encourage them to have access into the administrative processes and understand the pains that you face on data exchange. And then the second part is like, I would say AI is just a tool. It kind of helps you address some of the complex, I would say, labor intensive jobs. It can reduce that pain point for you. So let AI become a natural solution to some of these problems once they're identified correctly. I think these are two things at a strategy level I would definitely encourage most facilities to look at, because that can reduce a lot of their burden.
Yeah. What would you say is the biggest fear? I think you just said it, but what is the biggest fear on fixing this gap between sharing data between physicians and families and practices? I think you probably just said it, but just to say it more clearly, it's privacy.
Privacy for sure.
Yeah.
But I'm going to kind of present to you a slightly counterintuitive view that I may get a lot of criticism for. But while it's right for us to be afraid about the privacy of our data, and that we should continue to build strong measures to protect that privacy, I think at times we lose the perspective that care is more important than privacy. If we can save a life and in the process violate access to their data, temporarily, I think at that point, privacy should not come first. But yes, if somebody intends to collect a lot of this data and sell it to somebody and make money out of it, that certainly is a crime. I think that should not be allowed, and that should be a central concern for everybody who's building technology in the data and AI space. And we feel the same way. That's why I think our the approach to solving that problem is make the data subject, or the person that the data belongs to, make them the owner and in charge of the privacy of that data, give them the tools and the ability to share as they see fit, and then also give them the ability to revoke that consent or access that they
Mhm.
have given to somebody by keeping them informed on who all has data access. So I think decentralizing this data privacy would probably be the right direction to move in. That's what we believe in strongly. That's how we started thinking about it. If I had my mom's data 3 years ago, I could have gotten really good care delivered to her. But because she doesn't live with me and all her paperwork is elsewhere, I could not do it. And
Mhm.
if she had access to all her data in one place, and she could have temporarily granted that access to me, which then I could have taken to a doctor and asked them for help, that could have saved a lot of pain for all of us. So I think patient health, saving a life, improving a quality of life first, then privacy, and then abuse. Like we must work on eliminating the abuse of data. People should not be monetizing patient data. And if they must, then it should be done with the consent of the patient, so that the patient or the data subject also gets a share of that pie, if we are
Yeah. Yeah.
monetizing that
Yeah.
data. Yeah.
Yeah, yeah. I know when we've worked on some development projects with some of the facilities we've worked with, just HIPAA compliance is such a major hurdle and fear.
Yes.
And moving into these new tools, especially with AI, even though there's a number of really wonderful HIPAA compliant, really locked down AI data services that are available, which I'm assuming yours is as well,
Yes, absolutely.
that there's just no reason to wait and to not move forward if you have a guide to move you there, which sounds like a programmer from Amazon would be good for that, to
I
help
stand.
navigate those hurdles that maybe physicians are ready to embrace, but perhaps administration's not. So I'm sure that's one of the objections that you have to overcome. Tell us a little bit about just for what you're doing next over these next few years. What's over the next, I don't know, a year, let's say. What are some of the challenges that Solid Health has to overcome in order to keep moving this conversation forward and get your technology just active with increasing number of health providers?
I think there are two major goals that we have. One is to become a truly trusted source. We call it the care continuity concierge. Care continuity is important in that phrase because there is no real solution today for care continuity across EHRs, across hospitals, across providers, across stages of life. And even as you travel from one location to another, your care breaks down, right? So that care continuity is the most important thing. And concierge, because typically a healthcare concierge is a very expensive service that an average American cannot afford. So we are trying to use AI to kind of make it affordable. So we feel like,
Yeah.
the first goal is to build trust that we can be that care continuity concierge that truly believes in consumer advocacy and gives you or gives the patients, the users, the empowerment they need to track their health well. And then the second important goal for us is to deliver outcomes. We don't want to build technology for the sake of it. We actually want to measure outcomes. And for the next 1 year, our focus is going to be, as we work with some of these pilots that that are underway, we want to learn and improve the ability of delivering outcome through this technology. Something that is concrete, that is measurable. People can see not only some data, but also feel better, personally. When I show you a dashboard about your health, you should be able to tell me that yes, actually, if there is an upward trend in certain parameters, you can actually feel it in your, like personal healthiness, right? So that's what our second and most important goal is. So build trust and deliver outcomes. That's the two things that we are focused on right now.
Great, great. And so as you're analyzing these pilot programs, what are some of the metrics you're using just to demonstrate the validity of this platform?
Yeah, I think that's a great question. There is a diverse set of metrics. We are trying to still identify what would be a real KPI because we also know from the tech world, you you define a KPI and everybody would just kind of align to that KPI. So we don't want to create an artificial KPI and then start tracking it. I think right now, let's say for one of the solutions that we are building, which is the skilled nursing facilities. The readmission rates over there is probably one of the biggest challenges that both the facilities as well as the patients face. Even though, like, keeping patients in a facility could seem like a good thing for the facility because they can keep making money. But that's not really true. What I've realized is that many of these facilities and the companies that own these facilities, they are actually truly empathetic about patient health, and they really want to not see these patients come back once they've been through their care. So I think readmission rate is probably one of the biggest metrics that seems like we must demonstrate our value through. And then subsequently, because we track all the health vitals, we would like to see, for instance, if your blood glucose level, even see, if it's at, say 7%, and with the use of the application, beautiful use of the application, we can help you and your care team bring that down to 5.5 over a matter of 90 days. Then that's an individual level metric that really matters to us. So I wouldn't say like we have a silver bullet yet that kind of tells us, we are there, but we are experimenting with a lot of different metrics to decide what would be a clear indicator of success for us.
Okay, great. Well, I wish you the best in your journey. Sounds like this is some amazing technology that could be incredibly helpful for families. And as I mentioned, and when you're talking about caring for some of the people that are most important to you and your family and can't always communicate all the things that you need to be able to care for them. Wow, what an amazing tool that I just can make a huge difference. Thank you for joining us. Is there anything else you'd like to share just about patient retention or about Solid Health before we sign off for the day?
Thank you for inviting me, Mark. It was a wonderful conversation. Thank you for giving me the opportunity to share with you our journey and where we are headed. I don't have much to add. I would only say that, look out for our updates. We are really trying our best to basically provide this truly democratized access to data where each individual owns their health data and they're able to drive their healthcare journey on the terms that matter to them. So, please, go take a look at our website, SolidHealth.AI, and join the wait list. We are about to announce a window of public onboarding where anybody who's on the wait list would be onboarded, and we will also allow people to just sign up directly. But this will be a short-lived window because we are still in our early days and we are still kind of learning about how consumers would use this new paradigm of taking care of their health and share feedback. That's how we will get better, and hopefully we will deliver some real outcomes for everyone. That's all. Thank you so much.
Fantastic. Well, thank you. You have a great day, and we appreciate all that you shared with us.
My pleasure. Thank you, Mark. You have a wonderful day as well.